Hi, I'm Crystal Welch with First Ladies Academy of Sacramento. I want to thank you for joining us today for our health symposium. I also want to thank American Heart Association for making this whole thing possible with partnering with us. So I hope that you enjoy all that you hear and see today, and I hope you take advantage of the panel of doctors that will take your questions later on in the program. But for now, I'm going to show you a little bit about two things. You're going to hear throughout this whole symposium about knowing your numbers. And the two things that I'm going to speak to you about right now is knowing your numbers for blood sugar as well as blood pressure. So I have a couple of things to kind of help me give a little bit of a demo about that. But first I just want to mention to you, it's a good idea. American Heart Association has great information on their website. It talks about knowing your numbers as far as diabetes goes, what the normal range is for that, as well as what your normal ranges are supposed to be for your blood pressure. But I also encourage you to keep in touch with your doctor and discuss with them what your normal ranges are. Hopefully these tools that I show you in order to track those things for diabetes, if you're diagnosed with diabetes, as well as tracking your blood pressure, will help. Let's start with diabetes. If you're diagnosed, you'll probably have some sort of checking mechanism that you use. Sometimes there's the automated ones that you can use now that are really nice, but there's also the ones that you use a kit for. This particular brand is called AccuCheck. I got it at a Walmart for under $20. I do not personally have diabetes, but there is a history of diabetes in my family. And because I do a lot of fasting, just for my own personal information, if you will, I like to keep track of what my blood sugar is during those fasting times to make sure that I'm not putting myself in danger by having too low of a blood sugar, which can be dangerous. Because sometimes I have to stop fasting because I actually get really weak and it's hard for me to think if I go too long without eating. And because of that history, I just like to make sure that my blood sugar isn't too low. So one of the things I check it with is this kit, and just a normal range for a fasting blood sugar in a healthy person is between 80 and 130. So knowing that, I'm able to track that by using this. So I just want to show you this particular kit. It comes with the actual device to monitor the sugar itself. It has the testing strips, and it also has a nice auto lancet. I prefer the auto lancets. I actually have the other kind because I've tried to use this before and they're a little harder to use by yourself. These are more like, what you would use if you had somebody else checking your blood sugar, because it's kind of hard to poke yourself with these. These are nice, the auto ones, because you just push a button and you don't know when it's coming, so you're not going to pull away. There's a couple of things that you need to get if you're going to check your blood sugar that are kind of mandatory to have and things to remember when you use them. One thing is it's nice to have the alcohol or the alcohol preps, because you need to clean the space, the place on your finger where you're actually going to do the poke. Another is maybe some gauze or a band-aid for after, in case you're somebody who bleeds a lot, because even that little poke can kind of bleed a lot if you don't pay attention. And if you're on blood thinners or have any sort of bleeding disorders that cause you to, you don't clot well, it could actually make a mess. So you want to make sure that you have something to kind of catch that and stop the bleeding. So when you're going to check your blood sugar, you want to find a place. I actually have a table, you can't see it from there, where I have everything laid out and be able to set it up correctly, because it's kind of a quick timed kind of thing, if that makes sense. So with mine, I'm going to just show you a little bit about it. If you are diagnosed with diabetes, it's nice if you have to, start checking your blood sugar yourself. ask your doctor what's the best type of way to test, and maybe ask for a suggestion of kits. For example, if I had diabetes and I went out and got this test, a good idea is your next appointment with your doctor, bring that test kit with you and ask them to show you how to use it correctly if you're not sure. There's also instructions and manuals that come with it that help, but it's just nice to know how to use it correctly, because if you use it incorrectly, you can get incorrect numbers. So one thing that's really important about making sure you get the right numbers is that you don't touch the portion. I'm going to pull these out, but see, they're already sticking up. You kind of have to grab it from the side and try not to touch the tip of this lancet, because, or not lancet, of this test strip, because if you do, you'll damage it and contaminate it actually, and it may give you a wrong sugar reading. So for this particular test, as soon as I place it on there, I don't push it all the way in until I'm ready to take, or actually ready to put my blood on the actual strip. And that is because as soon as you put it in there, it starts to read the strip. So you have to make sure that it's out, it's just hanging out a little bit. And then when you're ready to stick it from the sides, not the tip, you push it all the way in and it'll be ready to read it. I'm going to show you how you would take your alcohol prep. I like to use my pointy finger, but if you're a diabetic and you stick a lot of times, you'll probably use all your fingers, because what happens is you start to develop some thickening in your skin and it gets a little hard to get blood to come out. I am not one that uses it all the time, so I'm able to use the same finger each time because I don't really check my blood sugar that often. Make sure you allow the alcohol to dry completely before you stick, because if you don't, it's going to burn a little more than it usually would if it didn't. And this one, like I said, is an auto injector. So I'm able to switch it to the actual number. There's actually 5 in here before I have to change it out before I stick. And I think this is empty, so I might not be able to show you blood, but for purposes. Then once you're able to, your alcohol is dry, you're going to push this button. I think this one's out. But you'll hear a spring click, and then you'll obviously feel the sting of the actual puncture. So once you do that, if it doesn't bleed right away, you're going to kind of milk it out, if you would. So you kind of work your finger from the bottom to the top to get some of that blood out. And then you're going to pick up your tester with the strip not all the way in yet, and you're going to get a little bit of blood on the end, just like that. And once you get it on there, you're going to press it in all the way from the sides, and then your machine should turn on and start to give you a number. Because I don't have any blood on here, it's not giving us the range or what it is yet. But as soon as you push it all the way in, I don't know if you can see that, the machine begins to read what the blood sugar is. And then it'll pop up, and then you want to write that down. Some of these actually store that information in there, which is nice. And like I said, check the manuals and whichever device you have in order to show you how to do that. But that's it for the blood sugar. Like I said, it's very important to keep track of that, especially if you have a history of diabetes and now you're responsible for keeping track of that and making sure that your blood sugar is at its normal range throughout the day. And it's just like I said, with knowing your numbers, if it's, your body's going to tell you, maybe you remember in the video with my brother-in-law Kirk, who said that his body was telling him things before he noticed about the heart attack. The same thing when you're monitoring your blood sugar. You're going to feel different whenever it dips, meaning your blood sugar goes down. You may feel a little weak or start to feel unable to focus or lightheaded or headache. So that's when you know, especially if this is new for you and you're still trying to figure out what this is, then maybe I should check my blood sugar. It must not be in its normal range. It might be low or it might be high. So just keep that in mind with the diabetes and the blood testing equipment. And then of course, make sure that you keep everything clean and wipe any excess blood if you get anything anywhere, and keep track of, especially if you have the automated one, the Lancets, because this particular one is out. That's why I couldn't show you. I actually would have given you my true blood sugar for today. And then check and make sure that the date on the outside of the Lancet or the test strips is within that time frame, because that too can make a difference on whether or not your blood sugar will register with the correct numbers, because if they're expired, they might not work properly. So keep that in mind as well. I want to say that, again, American Heart Association has some really great videos and guidelines and tips on their website, and it would be a good idea to check those out and just, educate yourself even further with what you hear today. So the second thing I want to talk about is the blood pressure and how you can track that on your own at home as well. Even if you don't have a history of blood pressure, it's still a good idea to, just keep track of it and know what the numbers are. Talk to your doctor, especially if there's a history in your family of high blood pressure. In my case, there is too. I have, both sides of the family. One side has the diabetes and the other side has the high blood pressure. Both my dad and my sister are on medication for high blood pressure right now. So that runs in my family. So I actually have the manual blood pressure cuff and stethoscope for work. So it's kind of hard to do that on your own, but it's possible if you have to. But I just want to show you what it is that you have to do in order to test it on your own. So also, this is another thing that you want to talk to your doctor about. Maybe they have a suggestion on what kind of blood pressure cuff they want you to use, or what particular one they find has the best readings as far as the automated ones. And it's really important to make sure that those are maintained and calibrated, because if they're not, they're still going to give you a wrong reading. And it's also important to make sure that you have the right size cuff when you take your blood pressure, because if you don't, that too can affect the reading of your blood pressure. So this particular one is an adult large cuff. I'm obviously not going to be able to take my blood pressure on my own and tell you what it is, but when you're using it, you want to make sure that you place it, first of all, you have the right size, and then you place it correctly on your arm. And I say this is probably too loud in my mic, because on the blood pressure cuff itself, even if it's an automated or the manual one that you use, there's a place on there that says artery. That's where you're going to place that piece of this whole cup into the front of your arm. And it's going to go right in the middle of your arm, right above your elbow on that arm. And you want to make sure that also it has left, right on there. Try to use your left arm if you can, unless your doctor tells you for whatever reason that you can't use the other arm. The left arm is the best arm to use for the blood pressure. And it gives a better reading, because sometimes it's lower on the right side. I don't know if it's because the heart is closer to the left. Maybe one of our doctors can answer that for us, but I'm assuming that that's why that you want to have it on that side, because of those vessels are greater on that side. Also, a couple of tips about taking your blood pressure. You want to make sure that there's no alcohol, tobacco, or caffeine use at least 30 minutes prior to taking your blood pressure, because this can alter what your blood pressure numbers are going to be. It wouldn't be its regular state because you're taking something that can change your blood pressure. Even though you may not be somebody who has a history of high blood pressure, just consuming or partaking in those particular stimulants will change what your blood pressure range will be. So it's better to not have used any of those within at least 30 minutes prior to taking your blood pressure. So you want to make sure that when you take your blood pressure that you're seated and you're comfortable, and you wait about 5 minutes before you begin taking your blood pressure to kind of settle down a little bit. So again, sitting down, you're going to place it on your arm, right above the elbow. Make sure the artery part is right in the middle of your arm, center in the arm, and then stop talking. Make sure your feet are flat on the ground before you push the button. And then allow it, while it's taking your blood pressure, obviously it's going to get tight on your arm. Relax, don't get tense, because that's also going to mess it up. So it might take some practice to kind of get used to that and doing it yourself, but try to make sure that you can do that when you do it also. And then again, keep a log. You want to write down what that first blood pressure was, and then you want to wait about 2 minutes before you go ahead and take another one. And then hopefully, depending on what you were doing, if you were just coming down the stairs, I live in a 2-story house, so it might take me a little bit longer to kind of get back to normal. If I come straight downstairs and sit down and take my blood pressure, it's going to be a little bit higher if I don't wait and let my body kind of settle back down than if I waited that 5 minutes before I take the blood pressure. Then after 2 minutes after you take your first blood pressure, you're going to take it again and then write it down and then log it. If it's within your normal range, great. Go about your day, keep that information, and check it again as needed. But if it's higher and still high and you still haven't been able to get it to come down, wait a few minutes longer and then take it again. And then if it's still high, then you might want to call your doctor and see, if it's something that you should be concerned about. And they may instruct you to take further blood pressures, or depending what your advice nurse or your doctor themselves tells you to do, they may ask you to come in and get checked out. So this is why knowing your numbers is so important, because when they're out of range, then you know something's wrong and that you need to address it. So hopefully this information that I gave you is helpful. Again, it's always a good idea to consult your doctor when you are trying to, manage these numbers on your own, to, make sure that you're using the equipment correctly. Your doctor is your health advocate, and you have to be a self-advocate and partner with him as well, or her. Don't be shy. I know if I was your doctor, I'd be glad to help you, guide you, and if you're having to start taking your blood sugar, on how to use that particular kit correctly, as well as having the right blood pressure cuff and using that correctly too. It's not a bad idea if you think that maybe your blood pressure cuff isn't calibrated or isn't working properly, to also bring it in and see what they think about it by comparing what you get on your personal blood pressure cuff to what the nurse or the doctor gets there in the office. That can also let you see if that cuff is actually working properly, or if you need to get a new one or recalibrate it. So I hope you enjoy the rest of the symposium. And again, I hope that this information was helpful. Once again, I want to direct you to the American Heart Association website for more information and guidelines for the numbers. And I have a great day.